Just taking a quick look at the people who are suffering with persistent pain. So that type of pain that's been there for maybe more than 2 or 3 months. Maybe you have some days that are better than others. You have your pain for 2 or 3 days. It's not as bad then for a day or two, and then it gets bad again. That type of thing here. Say you're doing your movement in your exercise and you feel that familiar pain. You have two routes, two options. A lot of people get stuck in option A here. You start to catastrophize, think about it a lot, thinking about it amplifies your pain. You're into negative thoughts, you're blaming others. You stop all exercise. There's often a fear of exercise and you go avoiding movements. You worry about it, your sleep is affected, and then you move on to this side here where you go and look for a more expensive consultant or a physiotherapist to confirm your bias, that your spine is actually out of place. You look for a better placebo, whether it's pill, injection, or the ultimate placebo, surgery. This then is going to leave you with more pain and less movement. You're back to this area here, and then you're probably going to try someone else out. Your other option, when you feel that familiar pain, is option B. Realize that if that pain has been there for more than 2 or 3 months, there's a high likelihood that that pain does not reflect any sort of tissue damage. It's more a protective tension. Don't worry or stress about it. Breathe in order to calm your nervous system. Change your movements. So instead of avoiding all movements, if you can't do exercise A, just try exercise B at a much lower level. You're doing that for a few days. Next thing, you start to feel better. You're back to your movement and exercise. You continue on with that, and then you can progress on to higher intensity strengthening and exercise. A lot of people who are in this cycle of persistent pain, they go to here, here, back to here, and they're staying in that. Unfortunately, it is down to you to break that cycle. No one can really fix you from the outside. You need to realize and understand your pain and then move and get specific options here, whether it's specific exercise that are suitable for you or specific breathing techniques to bring you back to this area here. A lot of it starts with your understanding of pain, which needs to be addressed.